Assalamu alaikum. Bismillahir Rahmanir Rahim. I'm Dr. Abu Haque, MD, practicing internal medicine in Long Island, West Islip since 2020. I repeat, since 2000, August of 2000, almost 20 years. So with this present healthcare situation, pandemic all over the world, people are getting panicky, everywhere, everything shutting down. We would like to focus very short, important issues so that our viewer can get a common knowledge, what they need to know, and have the common practice to help preventing and spreading this disease. I'm not going to go in detail, complicated issues, just simple, very common things for everybody. This will be my one part while I'm sitting and talking. And after that, in my practice, in my office, in this short period of time, I have taken some steps and arrangement to manage this suspected patient, any patient with fever, cough, and how we are separating them and how we are keeping them in a way so that they don't become potential source to spread to the other healthy patient or to our personnel. There's nothing is 100%, nothing is perfect, but we can do the best. At the end, I'll have a quick look tour in my office, so that our viewer going to the doctor, they can suggest their doctor to try to do the same or even better, or same if in a doctor viewing, they can get some experience what we are doing. Hopefully the doctors in the meantime, they know what to do and they are doing the best. So again, overall we pray to Allah so keep us safe, healthy, and the Almighty Allah is the most powerful. He is the decision maker. He knows why He has given this thing to the human being. There are alems, specialists, they can explain that religious part, but as a physician and as a believer, that's in short I can tell there is every reason, everything happening in the world, there is a reason, and God is doing for better cause. I believe that. Okay, so first, what is coronavirus? In short, again, according to the World Health Organization, coronavirus is a type of virus that transmitted from animal to humans. When a new strain first infects human, it's called a novel coronavirus. It's known as novel coronavirus. A new coronavirus, COVID-19, has been identified as the cause of cluster of severe pneumonia cases that emerged in Wuhan, Hubei province, China in December 2019. Since then, the virus has spread to all over the world, and including US, and World Health Organization has declared it as a pandemic. Endemic means it's a certain area of the world. Pandemic means all over the world is being infected, exposed, and the risk. The illnesses they cause, coronavirus, fever, cough, and the severe cases they get acute respiratory syndrome is called SARS, and Middle East respiratory syndrome also. There is another kind of presentation they have made, a little bit of different in the Middle East areas. So as I said, COVID-19 coronavirus is discovered in 2019. It's a novel coronavirus, new infection. Here is very important, our viewers should pay attention to, fever, cough, we get it from a lot of other causes. Mostly this time of the season is the influenza. Still, influenza is more prevalent, more infectious, and more deadly the coronavirus. Uh, just to common sense and to see what you look for. If you have fever, cough, most of the young healthy people, they limit that. Some of them gets a little shortness of breath, but elderly people above age of 70 has other comorbid heart, lungs condition, they can get to that respiratory distress syndrome, needing hospitalization, intensive care. So coronavirus is usually fever, cough, worst scenario shortness of breath. On the other hand, influenza has other symptoms. If you have those symptoms, if you test positive for influenza, which is easy to do, any doctor, anywhere, anybody can do it quick, even at bedside, in a minute or so, few minutes. If you have those, most likely not coronavirus. The influenza symptoms are even more, like fever, chill, cough, sore throat, runny, stuffy nose, muscle, severe body ache, headache could be severe too, fatigue, vomiting, diarrhea. If we compare this coronavirus and influenza, coronavirus usually does not have sore throat, stuffy runny nose, muscle body ache, headache, fatigue, vomiting, diarrhea. Coronavirus usually does not have these symptoms. So if you have these symptoms, fever, body ache, headache, fatigue, vomiting, diarrhea, most likely influenza. You can get to your doctor, they can go to get to any urgent care, they can quickly test for influenza. However, the coronavirus is usually, again I mentioned, fever, cough, and shortness of breath. So coronavirus is a bad thing is that the carrier can have symptoms for a week, 2 weeks as well, and usually travel transmitted through air and cold air, even after ill person is no longer near to each other. But on the other hand, flu usually transmitted with close contact through sneezing, talking. So in general, for general viewer, this is the common thing. I tried to explain to you. The symptoms is most important. You can differentiate what you have, and you can call doctor, give them the right information. And most of the doctor office, all of the doctor office does not have any capacity to do the test yet. If you have symptoms, call the Department of Health, your local area, or you can, contact the CDC through email, cdc.gov, and get the advice where to get tested. It's strongly recommended, don't unnecessarily go to the emergency, overflow the emergency if you have mild symptoms. Some of the counties now, they are starting walk-in testing center. I heard today the Governor Como is saying that they have opened one in Nassau, walk-in through test centers. So it will be more available hopefully as the days goes on. So we have to pray for the best, try for the best, and God forbid something happen emotionally, we have to prepare for the worst. Obviously, if you have symptoms, use the mask. Try to stay at least 6 feet from each other. Follow all the other government advisory, not to gather more than 10 people. Don't shake hands. Do rather the elbow, touching, and cover your mouth all the time. Sneezing, coughing. You use the tissue paper or whatever, and make sure throw that tissue paper in a garbage can with a plastic liner, not in the without any, not in a can or somewhere there is no liner. Excuse me. So this in summary, and again another thing to let you know, coronavirus, everybody getting panicky, afraid, die, is healthy adult as per the statistics. Up to 60 years of people, death rate is less than 1%. Excuse me. Below 40, virtually no death. They get mild symptoms. Death rate goes high to about 8% when 70 to 80. Above 80 is somewhere 14, about 14-15%. If somebody is healthy, death rate is below 1% even, healthy. People have cancer, they are around 6%. People have blood pressure, around 6%. People have chronic respiratory disease, about 7%, and the diabetes also about 7%. And patient with heart diseases, heart failure, other cardiomyopathy, they are about around 10%. So far, that's the statistics. So young, healthy adult, below, I should say, age of 50, not much to worry. Still avoid the precaution. You can always call your doctor, get tested. If you have symptoms, stay home. And the people with above 70, other health condition, as I mentioned, diabetes, hypertension, chronic respiratory illness like asthma, COPD, and heart disease, cardiovascular disease, cancer patient, they should seek immediate medical attention as soon as possible in proper places. Like if it is a respiratory symptom like shortness of breath, they should go to the emergency and get tested and necessary, get monitored and admitted in hospital. That's in short about the disease, its virulence, its effect on human being. Now, most important thing I would like to tell is steps we can prevent the spread of this virus. I'm holding a little pamphlet I have put in my office as well. That's 10 steps to prevent the spread of the coronavirus. We have heard that some places they have been, people are being targeted, like Chinese, Asian, few incidences. That's not happen. Everybody are potential risk. Everybody should do the same, precaution to prevent it, spread the disease. So let's make sure excuse me, we don't do any kind of targeting to regardless of age, ethnic background, or this coronavirus involvement. So now I have these 10 steps. I can focus it on the camera, and I'll try to read it a little bit, the 10 steps. Here, number 1, stay calm. Think carefully about how you can help your community and loved ones. Number 2, stay home if you are sick. We want everybody to stay as healthy as possible. Number 3, if you believe you are exposed to COVID-19, coronavirus, or have a fever, cough, or shortness of breath, call your healthcare provider immediately, as we discussed in my earlier part of talk. Cover your nose, mouth when you sneeze. Make sure you use tissue and throw them away in a lined trash can. Number 5, avoid sharing household items. This applies to cups, eating utensils, bedding, towels. Number 5, disinfect objects and surface in your home and at work. Use an alcohol-based sanitizer that contain at least 60% of alcohol. Again, this alcohol is also Islamic way of law, is haram, forbidden. However, so far I know, if it is not taken by mouth, I'm not an expert, but so far I know, if not drink or eat, if you are used for medicinal purpose, and if it is used on the surface, I think is allowable, so far I know. But again, if you have any issues, you can consult some mufti or imam about that. So as long as you are not drinking for your or eating it for your addiction purpose, I think it is okay. So number 7, sleep well. Your immune system is working best if you are well rested. Number 8, wash your hands a lot. Use soap and water for at least 20 seconds and wash often as you can. Avoid touching your eyes, nose and mouth. This will help reduce the chances of you getting sick. And number 10 is also get a flu shot. It's a flu season. It's best to stay at full health. As I mentioned, the flu is even more prevalent, more sick, it causing more death, and at least you can take the flu shot, prevent the deadly flu, and that will help you at least stay away from some of the symptoms, as I said, if it's related to the flu. And I think that's it. And as I said, we pray and hope for the best. Inshallah, everybody stay healthy. Everybody has a, get an imam, try to help other people, to help Dawah. As a believer, we believe anybody takes care of it, like in hadith, anybody takes care of a sick people. Rasulullah sallallahu alaihi wasallam said, like that person is picking a flower in the garden of heaven. So that's all I have to say. I end this up. I hope everybody stays healthy and take care of each other, and hopefully my little talk will help you some in this time of crisis. Now I'm going to give a little tour, few minutes, to what I have done to keep a medical office safer. Jazakallah khair.
ITV, Call of Peace, Save Humanity.